Or you're not imagining it, and we've been reporting on this a great deal. The number of COVID and COVID-related cases with these new variants, B4, B5, whatever they are, they sound like vitamins to me, but there are just a lot more of these cases. Now, they've been mostly very, very minor and mild, but they are spiking across the globe right now in about 110 countries where they are increasing. How significant is this? Should we be worried about this? A guy who always calms me down when I start freaking out is Dr. Frank Contessessa, the Northwell Health internist. Much more. He's a very smart guy. Doctor, always good to see you. Should we worry about what's going on?
Well, hello, Neil, and it's nice to be back with you, and thanks for the kind words. So, listen, yes, cases are going up. We're certainly seeing it here in the office. But as you said, they are, by and large, very mild cases. I have not admitted anybody to the hospital with COVID-related symptoms in probably 8 or 9 months. Even higher risk people, I'm really not seeing serious cases. I'm able to treat them as an outpatient. And, you know, that's really good news. So the answer to your question is no. I do not want people to panic about this. Don't be nervous when you see cases, the case numbers rise. What we're not seeing is a rise in the hospitalizations and deaths. They've really become decoupled. In the beginning, you used to see them kind of rise and fall together. And now what we see is that they decoupled from each other. So even though cases are going up, the hospitalizations and deaths are not.
To play it safe, doctor, I just walk around in a giant bubble myself, just to be very safe. But what is causing this? Why is this happening? Or is it just this is to be expected?
This is to be expected to some degree, Neil. The mass vaccination effort that we've been doing for the last 2 years, to some degree, may have accelerated the development of the variants, because the natural course of evolution is that the virus wants to evade whatever we throw at it. It's an arms race, right? And, you know, so we're trying to stay ahead of the virus, and the virus is trying to change itself to get ahead of us. So this is natural. This would have happened anyway. So what you're seeing is these variants develop. But the good news is they tend to become milder as we go. Now, interestingly, the B4 and B5 seem to be going back down towards the lungs, whereas B1 and B2, BA1 and BA2 of Omicron really were more sinus infection, runny nose kind of symptoms. Now we're seeing more lower respiratory symptoms again, but really the severity hasn't gone up, and that's good.
Finally, what is your recommendation? What do you tell patients as sort of the number of vaccine shots, boosters? What is the rigor du jour these days?
Sure. And, you know, this is a great question, Neil. And we've kind of addressed this together once or twice before. And, you know, the situation is different for everybody. And as I've said, I've told you, if you were sitting in front of me with, you know, immunocompromised, I would say take every precaution. You should be careful in crowded places. You should wear an N95 mask if you're in public. But for most people, it's really time to get back to normal. I tell people to treat this as if it's the flu season. Would you alter your behavior terribly during flu season? You'd be a little bit more careful. You'd wash your hands. I'm a little skeptical so far of the new vaccines coming out. They're not being well tested. Right. Matter of fact, the FDA panel has waived the committee to look at data to accept these new vaccines.
So
I'm hopeful that they're going to be effective.
All right. Doctor,
just be cautious.
Thank you very much. All wise words. I appreciate it, Doctor.